Hi everyone, and welcome to the very first Birds and BBV Bites. There may be some people joining along the way, and I think Katiska will admit them all for me. Yep. So, as I said, welcome to Birds and BBV Bites, dial in and take away. Right. And on the menu today, we have STIs with a choice of wraps, and your chefs for today will be myself. My name's Veronica Walsh. I work at the Aboriginal Health Council of WA, and also Maddie Whittle from SHQ is going to be joining us for the second half of this Birds and BBV Bite. Firstly, I would like to acknowledge the traditional custodians whose ancestral lands we gather on here today, the Whadjuk people of the Noongar Nation, and I'd also like to acknowledge the ancestral lands where people are dialing in today. I acknowledge the deep feelings of attachment and relationship of Aboriginal people to their culture, to their country, and to their waterways. And I wish to pay my respects to elders past and present, and extend that respect to all Aboriginal people that are either in the room or online today. And there's no one in the room with me because I'm in my kitchen all by myself. I'm actually locked away in a cupboard here at Aqua so I could take my mask off. Firstly, I'd like to say happy Valentine's Day to everybody out there, and happy National Condom Day. I love that one in the corner. Condoms are not 100% safe. My friend was wearing one and he got hit by a bus. That's just a sick joke from me. All right, so a bit of housekeeping. Look, if you could just mute yourselves, that would be awesome, because we've got to get through half an hour of information. I'm going to record this bite and I will work out how to get this recording up on our website. So if people miss it or they want to watch it again, you're more than welcome. So we'll get that happening. If we could leave questions until the end of the presentation, but you also can use the chat bar. If we don't get time for all the questions, then what you can do is you can email me, and my email address is on the flyer. If there's a fire, you can leave and head to your nearest escape. Feel free to leave when you have to, because I know it's your lunch break, and happy snacking. Okay. Rightio. So in this bite, we're going to snack on a brief summary of the 3 most common STIs. So we're going to be looking at gonorrhea. I don't know if you can see him in my salad bowl here. Gonorrhea. We've got syphilis. And we've got chlamydia. So we're going to be talking about those 3 today during this bite, how they're transmitted, the symptoms, the testing, the treatment, and what can happen if you don't get treated. Now, obviously, it's only going to be brief, but certainly we can expand more on these STIs at a later bite if you would like it. Second half of this session, Maddie's going to come in and she's going to actually talk about different ways that you can actually protect yourself from sexually transmitted infections. We won't be snacking on epidemiology, I can't even say that word, graphs. Again, that could be another bite if you really want to look at all the epidemiology of the STIs. And I won't be serving up any pictures of private parts. If you want to do that, you can go to Dr. Google. All right. So, yeah, I can't get, my arrow's not working. Sorry, I'm just admitting someone. Oh, there we go. I just have to tap on this thing and it works. Rightio, so chlamydia. So we're talking about chlamydia because it is the most common STI, and it's 4 times higher amongst Aboriginal people in 2021. Gonorrhea, we're going to look at gonorrhea as well, 19 times higher amongst Aboriginal people in 2021. And syphilis, was actually 30 times higher, and in some remote and regional areas it's even higher than that. So they are really, really important to talk about. How are they transmitted? Well, they're all transmitted through unprotected vaginal sex, anal sex and oral sex, and they're also passed from mum to bub in pregnancy and can also be passed during delivery. Syphilis, because it can produce a sore, and sometimes a sore that you can't see or feel, it can be also passed on through close physical body contact like grinding or foreplay. And you can't catch any of these STIs off a toilet seat. So how would you know if you had chlamydia and gonorrhea? Well, you probably more than likely wouldn't know, because about 20 to 30% of people with chlamydia experience symptoms. Probably with gonorrhea, men tend to know that they've got gonorrhea because they're more likely to be symptomatic. And by symptomatic, we mean that men tend to know because it really hurts when they pass urine. Sorry, I'm just admitting some people into the...
Yeah.
Hello, everyone who's joined.
All right, they've just started now, so yeah.
That's fine. If you could just put yourselves on mute, and I said that I would record this session for you guys as well and get it up on the website. So I don't think you've missed much anyway. And for a lot of people, this is just a refresher. Yeah, so also with chlamydia and gonorrhea, it can, if you are symptomatic, you can get a discharge from the penis of the vagina. And chlamydia the discharge is quite clear looking, so it can go unrecognised, as gonorrhea does produce more of a discharge that you do notice. Yeah. For women, they can get a change in their periods. It may be a delayed period. It may be that your periods are coming early. It may mean that you're spotting in between periods. So for some women, they may experience those symptoms, and also some may experience pain during having sex. But I think the message here is really mostly you wouldn't know. With syphilis, again, some people have no symptoms at all, or the symptoms hide. So you can see some pictures there. It's like an ulcer type sore. There's one there on the lip and on the tongue. So unprotected oral sex, you can actually pick up syphilis that way. And the pictures underneath are actually the syphilis ulcer on a private area. So again, they're usually painless, but in some cases they can be painful. They actually look painful, but not necessarily so. The longer the syphilis stays in the body, so you can actually have a sore and then the sore will go away and you think, oh great, you know, whatever it was, whatever I've had, it's gone away. It actually hasn't gone. If you haven't had treatment at that stage, you can actually go on and become what's called secondary syphilis. So those pictures down the bottom are secondary syphilis, which is the rash on the trunk, on your back, on the palms of your hands, soles of your feet, which is actually quite unusual to get a rash in those places. You can have patchy hair loss, like your eyebrows, parts of your eyebrows become bare. You can have the patchy hair loss on your scalp. And you can also form these sort of warty growths called condylomata lata, which sounds like a really lovely coffee, but it's actually not. They're quite horrible warty growths that can occur in the moist areas of the body, groin, under your arms, around your bottom, and around your private areas. So anywhere where it's warm and moist, you can produce these warty growths. Again, you can transmit syphilis at these stages, either with the sore, or you may not notice the sore, or you don't have any symptoms, or you could have these rash and patchy hair loss, but you're infectious during these stages. But I think the message is most of the time, people with these STIs, they look and they feel fine. I'll just check my oven, make sure that I'm not going over time. Okay, rightio. So we want to test at every opportunity that we can. If you're a clinician, young people aged 15 to 35, really good time to offer them an STI check and bloodborne virus check. During a 715 health assessment, when you're pregnant or you might be of childbearing age, definitely a good time to have an STI check. And remember that I think in pregnancy, we do STI and bloodborne virus testing very well. It's always normalised. There's often no questions about it. You know, women are tested during pregnancy and that it just happens normally. So we need to try and do the same thing outside of pregnancy, you know, for anybody who could be at risk. Change of partner. Anyone coming in for contraception, they're basically saying, I am sexually active, you know, I want contraception. We should be offering them an STI bloodborne virus test. Men who have sex with men at higher risk, and anyone with a rash that you can't explain. So maybe it's a syphilis rash. Unexplained arthritis. Well, we'll look at this because that has to do with gonorrhea. So we'll look at that in another slide. We want to offer people maybe what you could call it a respect test, which is what they use in South Australia, quite like that, rather than an STI test. A urine test, so we need the first part of your stream, a vaginal swab, if you have a vagina that you can collect yourself. Some services have a T-Tango machine, which means you could put a urine or a swab through that machine and you can get a test result in 90 minutes, which is fantastic. If your client's having anal sex or oral sex and it's unprotected, we should be offering them a throat swab and anal swab as well. Now, they can do the anal swab themselves, perhaps not so easy with the throat swab, and a clinician should really do the throat swab. Offer them testing for syphilis, which is always done with a blood test. For those that have got point of care, great opportunity to do a point of care test. And we'll talk more about point of care tests in another bite because it's quite in depth and a bit more complicated. You do get a result in 15 minutes with a point of care syphilis test. If the client has a sore, we take a swab from the sore, okay, and that's just a dry swab, this orange swab. And if the patient has a discharge, it's important to get a charcoal swab of the discharge. Okay, so treatment. Chlamydia and gonorrhea. If you live in the Kimberley, Pilbara or Goldfields region, you need what's called a ZAP pack, and that is 10 tablets that you take straight away. Wonderful, wonderful treatment, but really, really important that you have no sex for 7 days because it can take a while for the medicine to work. Really also important to come back and have follow-up check to make sure that you haven't been reinfected. Everywhere else, chlamydia is treated with azithromycin, which is 2 tablets. And if you have gonorrhea and you don't live in the Kimberley, Pilbara or Goldfields, what's happened in those areas is that the gonorrhea is now penicillin resistant and you need an injection of ceftriaxone. The syphilis treatment, fantastic treatment. Again, it's penicillin. We've always used penicillin for treatment of syphilis. It works very, very well. And contacts will need to be treated as well, and that goes for any STI. So they are given 2 injections into both cheeks of the butt. And depending on how long you've had your syphilis for, will depend on how many injections you will need. Really, really important for contact tracing that partners you've had sex with, you need to, within the past 6 months, need to know so that they can be tested and treated to be safe as well. So going back 6 months and those those people you've had sex with need to come in and be tested and treated as well. Because often you won't have signs and symptoms, so you might not know you have an infection, but you can still pass it on to your partners, and it's just better to get checked. And remember, an STI test is not complete without bloods for syphilis and HIV. So what happens if you don't get treated? Well, pelvic inflammatory disease can cause infertility. And I know we say that and we think, well, what does that look like? I've just put some pictures here to try and explain it a bit better. But as you can see, we've got a fallopian tube there that's quite inflamed. So if chlamydia or gonorrhea go up inside the uterus and get into these tiny tubes, they can cause infection. And this is called pelvic inflammatory disease. And the more times that you have untreated STIs and PID, the more likely you can get this scarring inside your fallopian tubes. And there's some picture there of some scarring. And there's actually, and when we say ectopic pregnancy, this might make more sense to you because now the sperm and the egg can actually meet in the fallopian tube, but if they meet and actually start to make a baby, it can get stuck in the fallopian tube, and this is where the baby can grow inside the tube, and it's called an ectopic pregnancy. So definitely untreated STIs can lead to infertility and ectopic pregnancy. If you're pregnant and you have an STI, babies can be born early because the bag of waters where the baby is lying inside can be irritated by the infection and the waters can break. And the babies can be born low birth weight. If there is chlamydia or gonorrhea inside the vaginal canal, particularly gonorrhea, the babies can be born with a pretty awful eye infection, which can lead to blindness actually. If gonorrhea is not treated, it can actually end up going into the joints, causing a gonococcal arthritis, and you are at higher risk of HIV. So where you've got an STI, you've got a breakdown of your own immune system, which means that you're at risk of other bloodborne viruses and STIs like HIV. If you don't get treated for syphilis, it can go on and become tertiary syphilis and can really, cause these gummers, which are just like holes in your bones. You can see there on your face and inside the mouth. Can cause problems to the major organs in the body like the heart, the eyes, can have effect on hearing, the brain, and before penicillin, a lot of people actually, went mad with syphilis. So it is a really horrible disease. But the main thing that we're particularly worried about with syphilis is congenital syphilis. So this causes stillbirths in up to 1/3 of untreated cases. This is my only graph I put up. I just wanted to show you that this is the rates of syphilis going up. And funnily enough, the highest rates actually occurred at the time that COVID peaked in 2020. But they're still going up. This is a little bit old, this slide, but it's following the same trajectory and it's still going up. So we want to test more in pregnancy. If you live in the Kimberley-Pilbara goldfields, we're actually testing women 5 times throughout pregnancy. But if you live in the other areas, it's 3 times in pregnancy. But we would always test if a woman had symptoms or she had a change of partner during her pregnancy. So you're at risk if you're having sex without a condom. You're an unborn baby and your mother has it. You're rubbing up closely with a partner and you could have a syphilis sore and not know it's there. You're sharing sex toys. Maybe you've been in prison. Definitely people who've been in prison could be at risk of an STI, but more so a bloodborne virus. If you're having unprotected sex for drugs or unprotected sex for somewhere to sleep. And this is where we're particularly seeing high rates in the metro area. Maybe you don't have access to condoms and dental dams. Maybe you don't know where to get a test. But I think one of the biggest things is that you actually feel too ashamed to get checked. And that's what us as health professionals and health workers and health promotion workers, it's trying to cut through the shame. So getting an STI test used to be piss easy, but we need bloods as well. So these are my cuts. STIs and BBVs are bloody piss easy. That's me. I'm now going to hand it over to Maddie, and apologies, Maddie, for going a little bit over.
That's okay. Just give me one moment and I'll set everything up. Let's see. I think I'm sharing my screen. Let's see. Hopefully everyone can see this. Let's have a look. Alrighty, I've gone a few slides ahead. Oh no. Thought I'd use Canva for a change. Can everyone see that nicely?
Yeah,
Veronica,
Maddie.
is that true? Sweet, cool.
Yep,
All right.
that's great.
Keep my time as well. It is 12:22. So just for the next 10 minutes, thought we'd have a chat about every kind of condom / barrier method that you can think of. So 10 minutes, I might go a bit fast, but questions at the end. And for those of you who don't know, I work at SHQ. I'm the FIFO project coordinator, which is a new project we've started this year. And I also am one of the health promotion officers as well. And before I begin, I would also like to extend my acknowledgement of country. And I want to acknowledge that all of us are obviously meeting from different lands today, but I want to recognise the land that I meet on today as well. So usually when we talk about condoms, we're all just thinking about the male condom. It's the most widely known one. It is easily it's the easiest and simplest way to prevent pregnancy, to prevent STIs, bloodborne viruses. They actually go back a long time. They're nothing new and nothing fancy. We've actually found them in like French cave paintings, in Egyptian hieroglyphs. So going back like 15,000 years almost sometimes. So they've been around for so long. We've come a long way though since then. They used to be made of things like animal intestines, and they would have to be rewashed and reused again and again and again. Once we figured out what rubber was, we started making them out of thick rubber, which was obviously not great for sensation. Again, reused constantly. When they're made out of animal intestines as well, ideal obviously for preventing pregnancy, but really not for preventing the spread of STIs because of pores in skin. We reckon, we have no records of when they were properly invented, but we do know that in the 1500s, a Catholic priest actually made a linen sheath to stop syphilis. So it's funny how back then we used to prevent syphilis and now we're here again trying to use it to prevent syphilis. But back then they put a little pink ribbon around it to make it cute. They've also been made out of things like tortoise shells and animal horns. So we're really lucky now. We don't really know how good we've got it. Materials now for condoms. The main one you'll probably know is the good old latex condom. In fact, most condoms that you pick up will be latex, and they'll say on the box latex condom. But more and more frequently now, there are alternatives to latex because people have latex allergies. So that means that if someone wears a condom and that's made of latex and they're allergic to it, they might feel like itchy, uncomfortable. It might give them like a red rash, which is obviously not really great. So there are other options. The main other option available is polyurethane condoms, like the one there, the skin condom. You'll see it around at places like Coles and Woolies. Some shops now stock them as an option. I've noticed some people don't even realize that they're not using latex condoms. That's how commonplace that's becoming. Both are typically pretty affordable. The latex one is cheaper. There is also still lambskin condoms. Again, much less common than the other two, and a bit more expensive. The main reason people like them is because they say it increases sensitivity and transfers body heat better. But again, the same downside is with lambskin is that it has pores, so you can spread STIs more easily because latex obviously and polyurethane have like no pores. So I think it's good to talk with people if they say, oh, I don't like using condoms, they feel uncomfortable, to ask like, well, like which ones have you tried, different materials, give it a go. There's also different sizes. I think people are often surprised when I say that, you know, like we have different shoe sizes and not one size, it's not one size fits everyone. So penises are kind of the same. And as a result of that, different condom brands have loads of different sizes. You can usually tell on the back of the box or in the back of the packet sometimes as well. They usually list or mention the width, which is, I guess, is like the girth of the penis. So it might be anywhere from 45 mils up to 69 mils wide. Length sometimes as well. Some brands have different sizes, like they'll have like 3 or 4. I have also seen some brands, like there's My One brand that isn't in Australia that has over 60 different sizes. So really, I think if people, like sometimes we do the activity with like, you know, the oranges in the condom to show people how easy it is to, like how condoms can fit everyone. But the problem is that, you know, even if I can fit like my whole fist through a condom, it doesn't mean that it's a comfortable fit. It might still be very tight, very uncomfortable, and is not really going to be great for a sexual, you know, a good sexual, pleasurable sexual experience. So if people say that, like let them know there are multiple sizes, and if you stock condoms as well, maybe even see if you can have different sizes to offer people. If it's too small as well, like if a condom is too big, sorry, it might like slip off during sex. It can actually make it more unsafe. So really letting people try different sizes is kind of increasing their ability to have a safe experience and increasing their ability to avoid getting STIs. So really there's good reason to tell people about different sizes. So aside from different sizes and different materials, there's also just loads of different types and different brands. I think people get really, we have this idea that condoms kind of make sex boring or it's an interruption. But I like to try and frame it as like, you know, you can try different types. There's like different flavors. There's glow in the dark. There's ones with different like types of lube in it. There's different all sorts. So I like to try and tell people you've got other options. Don't be so boring. Zhuzh it up a little if you can. But I guess availability is also a problem. A lot of these that I'm looking at here are online. If someone can't get to different varieties, then that can always be a tricky thing. So seeing how we can get that to more people is really important. So as for other options, again, we say like condoms and we just think of like the male condom or the external condom. There's also internal condoms or the female condom that you might hear it referred to. So instead of it going on a penis, it actually fits inside the vagina. So kind of like an inverse condom almost. So it can prevent STIs. The cool thing about this as well is you'll notice on the picture of the, I keep pointing at it, but you can't see me pointing at it, the opening of the vagina where the vulva is. If there's that plastic out on the outside as well, if someone's got a sore, that can also help to prevent the transmission of it, even if a condom is worn. So this is always an option for people, especially if they're unsure if their partners are going to wear condoms. But again, the issue is that they're not as easy to find or a bit more expensive. I don't think I've seen them available for sale at chemists. So access and awareness are one of the problems, like the reasons that these aren't used very commonly. But they are kind of empowering for some people because you can just insert it ahead of time before sex starts. If people think that condoms interrupt the experience, then this is another option for you. The next one is latex dams. So Veronica mentioned this earlier. So we talk about oral sex. We kind of forget that oral sex doesn't have to involve a penis. What if it's like oral sex on a vulva or on an anus? Like, what are people meant to do? Are they just meant to go without? Well, the latex dam is kind of the solution to that. So basically, you can see the little hand there. It's a sheet of latex, and it's held over the area, like the vulva or anus, to act as a kind of barrier. You hold it in place with your hands, and for obvious reasons, you don't want to be flipping it over because if there's bacteria on one side and you flip it over, it's no point. And one use only, of course. Right now in Australia, I believe there's only really one brand, and that's Glide. But there are different flavors, so people can use them. And I think it's really important to know that these exist, especially if we think about inclusivity. If people are told only about condoms and they must think to themselves, oh, well, if I'm like a lesbian or I don't have sex with men, there's no option for me. It's really a like validating to know, oh, well, you know, there's actually ways that I can be safe. And even if they don't choose to use it, it's really important that they know that they have that choice and they know that it's available. So if you have the ability to hand out latex dams, I really recommend it. I think you can have some really interesting conversations about condoms and safer sex and preventing STIs, because people are like, well, why would I use a latex dam? And I'm like, well, you know, STIs can be transmitted orally. So it's a good talking point and people are naturally curious. Next one is gloves. So again, it doesn't, I know that gloves don't seem like the sexiest of items, or they don't immediately seem like they're a safer sex tool, but they really can be, especially if like your fingers are involved. If someone's got sharp fingernails, a glove can prevent anything like from hurting the other person. If they've got like an injury or cut on their hand, or if the other person's got maybe a sore on their like vulva or penis, or on the anus, like that glove is just like a little extra backup. And again, there's different materials, so it can be latex or it can be nitrile as well. So that's a non-latex alternative. So it really, I think it's good for people to know these exist and to not discount anything that's not the male condom. And that's pretty much all I had to say. I was pretty much dead on 10 minutes. I'm very proud of myself. So yeah, I really think it's important that people know about all the different options, not because I expect them to use them all, because I don't expect them to use them all. Sometimes I don't even expect them to use any of them. I just want people to know that they exist, because when we have more options available to us, then we get to have more of a choice.